Hi guys, my name is Evelyn and today we'll be comparing between the Spanish flu and the COVID-19. First, I would like to start with the case definition. So for Spanish flu, the symptoms were sore throat, fever, headache, and chills, kills victims because it causes pneumonia and is spread through human contact. For the COVID-19, the symptoms were fever, sore throat, dry cough, and heavy breathing. It kills by causing pneumonia too and spread by water droplets, and it's airborne. For confirmation of outbreak and important dates, for the Spanish flu, the first case were in March 4th of 1918 by the name of Albert Gitchell, and the first mention of influenza is on April 5th in the weekly public health report. For COVID-19, the first case is 17 November of 2019, and by January 30th of 2020, the WHO declared a worldwide pandemic. For the death toll, for the Spanish flu, there were approximately 500 million infected and 22 million deaths. And for the COVID-19, as of April 9th, there were about 1,484,811 infected and 88,538 deaths. So who is at risk of being ill? For the Spanish flu, it targets young adults, even healthy ones. And it's actually less lethal for older people since most of the cases were young adults, while the COVID-19 targets older people and high-risk people. So let's move on to descriptive epidemiology. So for the Spanish flu, as you can see, there has been waves. So first you increase, and then the curves actually flatten, and it has an exponential increase, and it flattens again. And there has been multiple waves. While the COVID-19 is still exponentially increasing, and the Spanish flu ended by summer of 1919. Now I want to move on to the implement control and prevention measures. So for the Spanish flu, doctors and scientists were unsure since there was no effective vaccine, and hospitals were so full, so sometimes houses were converted into makeshift hospitals. Officials in some communities suggest quarantine, wearing masks, and shutting down public places. But in some places, such as Philadelphia, the response was too little that social distancing were not known, and the disease were spreading like wildflowers. There are also no antibiotics nor antivirals during 1918. For the COVID-19, according to the UK government, they are trying to detect early cases, slow the spread, better understand the virus, and provide best care. And some cities has been in lockdown, and the government has actually provided health instruction. And with the exponential technology present in today's, it's actually been more efficient, and it can spread to wider audience using phones and news reporters and online news. And school and public event has been shut down, but we are lucky enough to have the technology given to be able to study and work at home. And it also uses big data and information technology such as using QR codes, which we'll be discussing later on. For implementation of surveillance, for the Spanish flu, there were no WHO, so there was no surveillance systems. And they thought that influenza was caused by bacteria. So as you can see here, in 1918, they were not ready at all for the Spanish flu, and they didn't have the understanding required. For the COVID-19, I will take the China surveillance examples. So in China, everyone needs to measure their temperature and update their profile in China. Everyone had a profile, so then the government can keep track of who they think are infected. And they uses the health QR code to keep track of everyone who entered the city. And they also established electronic recording and tracking system and local response system to handle identified case 24/7. And this all represents some of the benefits of using exponential technology. For the QR code, people were getting 3 different colors when they scanned them. So if you get green, then you're allowed to move freely, while yellow requires 7-day quarantine and red requires 14-day quarantine. So with the exponential technology present in today's day, we actually have a better surveillance system. And this, as you can see in the graph, it has a big effect on the epidemic curve. It actually has flattened the curve in China, as you can see in the graph. So what toll did it take on society? For the Spanish flu, it wipes out families and leaving children to the orphanage. And there were also big economic emergencies since businesses were shutting down, and society couldn't work well since everybody was sick and even public workers couldn't work. And there were food challenges, and it's hard to harvest crops since most of the farmers were also sick. For the COVID-19 effect on society, it actually has more impact in the economy today since more businesses are involved in person services. So with everyone quarantined and sick, it took a large impact in the economy. It definitely took a toll in the community since some people lost their jobs and while some have to still go out to pay for a living even in the midst of the pandemic. But for those who are lucky, it reminds us how lucky we are to have the exponential technology present in today's day so that we can have a better chance at still working at home. And there are also good side effects of the pandemic, which is improving our air condition. According to Time magazine, the global air pollution has fallen due to coronavirus outbreak. So how does exponential technology helps to reduce change? So there are actually several ways, such as better communication, better services, better surveillance, and more aware since using technology can open us to having more access to information, and it has faster vaccine producing using supercomputers, medicine and transportation using drones. This also can be used for daily needs. So it reduces human contact, which reduce the chance of getting infected. It also uses AI and robots to replace humans in doing jobs. This also reduces human contacts, which also can help flatten the curve further. It also do jobs such as doctors, mixing compounds, and researching by gaining data. And that's it for my presentation. Thank you. I hope that you learned something new today.